How is AI affecting physiology, both the positive and the negative? So, sir, I think like I have seen that there are not much medicos who are active on LinkedIn. So, can you tell our audience those medicos who are not on LinkedIn, what are they missing
So the
out?
basic position you start off with is your post JRship is your SRship post MD. So the pays usually ranges from if you are a central government employee like AIMS anywhere, you have a seventh pay commission that is running, which is approximately.
Let's say if someone does his MD physiology and now wants to get into the academic route, that he wants to become a professor. So, like, how does a career in academic, how does a career there looks like? Like, what position they start in, and what is the topmost position they can get into?
So the basic position you start off with is your post JRship is your SRship post MD. So the pays usually ranges from if you are a central government employee like AIMS anywhere, you have a seventh pay commission that is running, which is approximately 1,25,000 to 1,50,000 range or below that, whatever this is, say seventh pay commission. So you go through that level. Uh, Next year you get your eighth pay commission release, so that pay will be increased. So SRship in central governments is a 3-year post where you need to publish multiple articles and you have your certain academic credits to build up to go to the next level of assistant professor. So post that 3 years, you have either 3 to 5 years of assistantship, where again you have your academic credibility to build up number of publications, number of speeches, number of orientations that you're doing. There also the salary increases. Then you go to after 3 to 5 years of assistant, then you go to your associate professor level, which is again a 3 to 5 year level, depending on whether you're in your state level medical college, a government college, a deemed university, or a national level institute. That is again a 3 to 5 year area. Then you go into professorship. Once you're into professorship, you're always in contention to become a HOD, depending on how your department is. So this is a stable income, no nonsense, always clear job. You will have stable income coming every month on time to you until and unless you're in a sham medical college. That is a different aspect to speak about. So you have your basic income ready. You have your all you need to do is get your academic credentials and your publications and your orientations done, and you're always there on the ladder to climb up. The timeline won't differ much. It's usually 10 to 15 years till you become a professor. I would say on the top level of 12 to 15 years, and then you become a HOD. I mean,
Perfect, sir.
that is after you're 55 years old. That's it.
Yes. So I think that is perfectly addressed considering the academic route after MD physiology. So sir, as you have mentioned about clinical physiology, so just as a fresher who has done his MD physiology, what are the different hospitals or different companies that are looking for clinical physiologists, and what is the beginner level role and also the salary, and what is the topmost level they can get up to?
So, as far as I know, there are very, very few people who are in India are currently doing clinical physiology. Very few people. One sir is doing his intraoperative neuromonitoring in SRM Chennai since Chennai. He has hustled a lot to get it done. Uh, and then very few people in the northern belt from Rajasthan, Delhi, Chandigarh, Uttar Pradesh. This area has very few clinical physiologists. What they do is they usually get attached with your medical college, and that is the hospital you're practicing in. Because the entry level job and salary is this is not a conventional route. So you do not have the backing of a stable salary that is coming. So what people do is they get attached with the hospital, they get attached with the teaching medical college hospital, and they get it running. If you want to establish your private clinical physiological practice, I have seen few people who are running clinical physiology labs in Uttar Pradesh. They're doing pretty well. I think it has become a very common practice right now. Few people are practicing in the northern belt again. in clinical exercise physiology. There, then also sleep medicine. Also, that few people are practicing. There, the salary is not fixed. It's how well you market yourself and how well you're getting the patient to you, and what is your charge and what is your equipment processing, and all those things depends on how you're marketing and how you're charging the patient. So there is no fixed salary. You can always reach for the stars, but you need to market yourself in that area, saying that yes, I am the pioneer or I am the best in this field, in this area, in this market, and I am able to capture that. So this is what I am able to charge you. If the patient is okay with that, yes. If not, then again, that depends on what is happening there in that market. So it's not fixed. You have to hustle a lot to create that opportunity for yourself. So for someone who's finishing his MD physiology, if they want to get this into this thing, so they're looking at approximately a range of 2 to 3 years of range where they're burning cash, but they're looking at the long run aspect to get the financial stability going. So I would suggest, get attached to a teaching hospital and you can do this in the odd hours. So you'll be getting your income in one hand, so you're not financially dependent on others. And also pursue, what else can be achieved and what else can be looked after. So that is what I would suggest, and that is what is happening at present in this country.
Right, so that is what my father always says: stabilize one wheel and then look for the another one. So that is a very that is a very good analogy that you explained. So, sir, is SRship mandatory in all the colleges after MD physiology?
Yes, SRship is mandatory in every college because what happens is in your PG life, you are running behind hundreds of things in your JRship. So to sit and get everything done 3 years is a little bit difficult. So in SRship, what you do is you focus on one area that you want to excel in. Say, for suppose you want to focus only on electrophysiology. In your PG level, you focused on everything, including electrophysiology. Now in your SRship, you only want to focus on electrophysiology. So that SRship gives you that opportunity to focus on one key area for your development. So yes, SRship is mandatory, and also where you choose your SRship also matters. You just can't dilly-dally yourself into one random medical college which has nothing and get your SRship done and get into assistant professor. If you're very serious about post MD physiology SRship, I would prefer getting it done in an institute, which offers high level of training for SR.
So, okay, we can opt out of our residency college for SRship. Like we can get into another college. It's not compulsory to do SRship in the same college.
That depends from state to state also because few states have bonds post MD. So to fulfill that, you will be doing your SRship then and there in that same institute and same college and same state. Few states do not have the bond system, so then you're free to go wherever you want.
For the Central Institute, do they have bond for SRship or they can opt out?
Central institutes, you don't have bond, but that is a contract based, usually a contract based SRship, which usually lasts for 3 years as far as I know.
Right. So during SRship, there would be just you will be focusing on one thing that you want to get done, not the everything that we're taking care of
Yes.
during the residency.
Apart
Yes,
from
sir.
teaching, you'll be only handling your key area, what you want to focus in.
Right. So, sir, now as we have seen that AI is affecting every domain, every career, not just medicine, out of medicine also. So, sir, how is AI affecting physiology, both the positive and the negatives?
Uh, I wouldn't say there are many negatives. The only negatives I can think of is the students who use AI do not know how to use AI. Most of the doctors as well, they do not know how to use AI because the technology is very fairly new, and most of them do not have the time to sit and run behind an AI technology. So most of them have little to no little knowledge in getting that thing AI knowledge done. So a few funny instances that I have faced is students just go on to ChatGPT or Gemini and say, "This is the book I'm referring." So give me the answer in the tone of this book. So the AI wouldn't know what the tone of the book is. It is not. It is a generative AI. It is feeding off of you to give you the answers. So you can't tell AI to give me the answer from the book that in what language they're writing. It's a medical language. It's basically bland language. So these are the kinds of prompts that people don't understand. If you give a proper prompt, AI will give you the best answers that anybody probably we can also not come up with. So having the knowledge of prompt engineering also gives you a big edge, understanding AI. I would look AI as a positive aspect entirely and completely rather than, terming it as a negative. It is there to enhance your knowledge. It is there to enhance your understanding because sometimes you might not understand a statistical value or you might not understand something of a biostatistical level. What better way to get your data analysis and your data encryption done than getting from an AI? Because you're not doing anything. Mathematics is already coded into that, so it cannot go wrong. So utilize that to enhance your knowledge and your understanding of the subject. If you just give a basic diagram and ask, uh, let us assume you're giving a basic diagram of a mitochondria into an AI system, into ChatGPT or Gemini. It will give you an entire thing, but that won't give you the answer that you're looking for. That is where prompt engineering comes in, and you need to be very aware of what you're asking to get the best out of it. That is designed for your life to get better. So don't push it away. Embrace that. So once you
Right.
embrace AI, it actually works miracles in any field. You can, do n number of things in medical coding. You can do n number of things in epigenetics. You can do n. Did you know there are like 20,000, I'm exaggerating, but 20,000 plus microRNAs, which was a Nobel Prize winning level last year. So all this microRNA data is encoded into your AI. So you can get the answer every then and there instead of going and searching individually books you won't get it. Those books are highly costly. So all the data is already available for your freeness. Utilize that and enhance your knowledge with AI. Don't push it away. Then again, you need to be smart enough to, not pick up all the nonsense also it is giving to you. That is where your brain has to work, getting in the best from AI. Getting the outputs from AI is a challenging task. Once you get used to that, then every branch in medicine, I believe, should embrace AI.
Right, sir. Sir, I also resonate with what you said that prompt engineering, it is like it is the basic skill that every medico should have. They should learn about prompt engineering to get their work done with more efficiency and saving their time. So definitely that is a very nice skill to have, not just for MD physiologists. Every medical student or let's say every student should learn this skill. So definitely that is very nice skill to be add on. And sir, do you think that AI will replace physiologist or is it replacing already the physiologist?
AI can never replace a physiologist. It
Right.
cannot happen. Not just in physiologists. AI cannot replace anatomist, a biochemist. AI cannot replace a general physician or a general surgeon. AI cannot do that. AI is just there to enhance what you already know into you becoming a better at what you want to achieve. It cannot happen. You see, you're the one who has created AI. How do you expect it's yourself to be backward from the process that you have created? Until and unless we're talking about Skynet level apocalypse in Terminator, we are not looking at AI to overtake human beings in any level whatsoever.
Yes, sir. So, sir, I think one thing you mentioned that the professionals, like many senior doctors, are not much aware about the AI. They are not using it wisely. I see there is a major issue with the adaptability that they are doing things traditionally over long years, and they don't want to adapt to a new system. But if they adapt and use this, they can exponentially grow their practice or their career. So So that is also very nice thing that you mentioned. Perfect, sir. So, sir,
So
now
there
let's.
something there. Can I add something to that?
Ah, yes, sir, definitely. Please go ahead.
Yeah. So there the problem is your senior faculty and your senior doctors, they got fine tuned in such a way that learning something new is a bit of a challenge and a task. So they know what they know and they're very highly knowledgeable. So they don't. Few of them are enhancing their skills utilizing this AI, and most of them they don't want to do that because they're in the tail end of their careers. They don't want to change something and complicate stuff. They're happy with what they know. They're happy with doing that. You cannot tell that they're not doing that. That that is a huge thing that nowadays I'm seeing from the people around me and from the perspectives of my other doctors. They are trying to embrace the AI, but the conversation of embracing AI in medical field has reached to such a level that if you do not know this, you're just lagging. So they don't want to get into that conversation. They're happy with what they know and they're getting it done. The work is getting it done. If they're not doing it, their residents will do it. The work is getting it done. And it's also not that most of them don't know. Most of them actually know. Just that they're not into the habit of showboating that yes, I know this, I can do this. So they're very ground to most of them with whom I know, they're mostly ground to earth people. They know what they're doing. They just don't want to showboat it. So that is something also we need to look at it. Every coin has two sides. So you can't term someone that saying that no, they don't know this. There might be a reason for them to not know that. So that reason
Right.
is usually not discussed in the grand scheme of things.
Right. So that was a very nice perspective. At the end, what matters that work is getting done rather than either in a traditional way or with the help of AI. And they have very much expertise in their domain. They are doing this thing like in a long term for many years. They have a lot of experience. So that is a perfect thing. That is a very nice perspective you mentioned. So, sir, now let's say that India is expanding medical colleges. Now they are starting, like they are planning almost every district one medical college. So, what do you think? Like there will be huge demand of teachers, physiologists in such medical colleges, or is it getting saturated?
Uh, are you a first generation doctor, Amir?
Yes, sir.
Okay. So my suggestion, I'm also first generation doctor. So my suggestion to any person who wants to pick up MBBS, I would say no. With the clear intention of not demotivating them, the only clear indication is that look at the numbers. We India has patient to doctor ratio at a good level, but most of them are located in the city level or tier one cities. Few of them have penetrated tier two towns. Very few have gone to tier three and further. So if you want to put each medical college in one district and you're looking for a physiologist or any medical person to come and get a job there, getting that is easy. It's not difficult. But then what matters is your lifestyle. That comes into a major part. What lifestyle a big city like Delhi or Bombay or Bangalore or Hyderabad offers, a district cannot offer you that. So those places would always have that vacancy unfulfilled. So that is something that people need to look up. And can we touch this point on a deeper level of the each district having a medical college?
Yes, sir. Definitely.
So here the problem is every district is opening a medical college. You're admitting 100 to 150 students in each medical college. You already have a certain ratio of doctors that you have fulfilled. Most of them want to be in the city again. Apart from this, the MBBS takes away your prime career, your prime youth. And most of the medical colleges teach you the basic mundane medicine that every that has been taught since generations. NMC might come up with new plans to integrate new things, but the system needs to be accepted is at ground level that implementation will not happen. On the paper level, yes, it sounds very good, but at a ground level, it's difficult because practicality and paper are completely two different things. Even with all that, you only have how many? 547 districts that are available in India at most, or let us assume 1,000 plus. Let us assume 1,000 as a criteria for districts. I'm not sure about the number. Let us assume 1,000 as a number of districts that are available in India, and each medicine college, each area has a college. So let us assume 100 seats. So 100 into 1,000, that is approximately 1 lakh. So we already have 1 lakh 23,000 or 33,000 MBBS seats that are available right now. Year on
Yes.
year, NMC is increasing little bit. So all these number of colleges are not just government colleges. They're private, they're semi-private, they're deemed to be university colleges, all those things. Where fees also comes into matter of play. Not everyone can, afford the fees. Not everyone can afford high budget fees and get the medicine done. It's not viable option. And MBBS in India, students are not just competing from students in India. Even NRIs can also come in and get it done. So fees option from them is easier compared to most of the people here. My advice to students is at 18 years old, you will have this insane energy to not listen to anyone, to feel that MBBS करेंगे तो yes, we will be in the best of the areas, but the reality is not that. You have 1,23,000 MBBS seats and you have approximately 80,000 postgraduate seats, out of which physiology, pharmacology, pathology, biochemistry, anatomy, forensic medicine, these are also included in that number. So these are mostly vacant now. So you're just running year after year, year after year, year after year to get one branch, which is general medicine or radiology, the gold standard. So you're losing time, you're losing your mental stability, you're losing your financial stability to achieve what? By the end of the day, now the post MBBS graduate is hardly getting paid 20,000 to 25,000 post MBBS. So it's not a viable option. People like you who are starting this Medhustlr and everything on the digital platform, I encourage that very well to start in the early phase of your MBBS. We didn't have this technology or we didn't have that knowledge to, yes, this is the place. So now we are starting that. So I want students to begin with that. So they'll have at least a different perspective in MBBS rather than, just looking at patients. Every every doctor who finishes looks at patients. What makes you stand out is also something you need to look into. So students need to be aware of a lot of other parameters and perspectives and not put their parents hard earned money or pick up a loan from a bank and get MBBS done. It's not worth it. I don't know if any people would say this, but I would definitely say it's not worth it. It's not worth going through the mental hassle of MBBS with a bank loan on your head coming out of it, which I didn't do, but I know I've seen people who have done that. So I know the pain and the stress that goes into it. So it's not worth it. Also, when you look at all these district hospitals, the facilities are subpar. How far can you go with a subpar facility? Then again, that becomes your headache to learn everything on your own. So you can't put the complete blame on the system. You can't put the complete blame on the faculty or the government or the students. It's a collective effort. When there is a demand, government is supplying. When the government has supplied something to you, you can't complain saying that there is a shortage here. Provide the facilities that are required, and then you see the result. So this is a very tight knife. Wherever you slide, you're getting chopped. So All these things are practical aspects that most people do not dwell into, which I feel people should be talking about more openly.
Yes, sir, definitely. That was very nice insight. That is why we started our channel and specifically this series where people should know openly address about these things and where we can discuss this thing openly without any keeping like sugarcoating things. So thank you, sir, for that. Sir, now let's tackle that. How is JSS Medical College and how is the physiology department over there?
It's a very good college. It's one of the best colleges in the country, as far as I know, because I not because I'm here right now. It's actually a very good college to be in. People are very, approachable. Faculty is approachable. The department is very, very nice. They give you the freedom to, do whatever you want, think whatever you want, but then within the guidelines and framework of how a department should be running. So they train you and mold you into becoming a better person. They train you and mold you into becoming a better physiologist. So the faculty I got, I believe they're one of the best in the country because I've been learning from them. And I cannot say this for every other college, but what I feel is I've lucked out. By hook or crook, I feel that I have lucked out in getting the best faculty and the best college. The facilities here also are very, very good, and they're open to trying very new things within the guidelines. And good. As a resident here, I would definitely encourage anyone to come to my department. Pick up MD physiology here. So there was in a brief period there was a gap in someone picking up MD physiology, and I was the first one happened to be joined in this department after that brief period. So they've taken very good care of me. And the best part is you get your stipend. So you don't have to depend on, your parents after so long. So you get every facility, and Mysore being a very good clean city, food is not a problem. You have a lot of things to explore here. You have your free time. You can do lots of other things that you want personally to do. I have two of the best co-PGs that anyone can ask. PG life is a difficult life because you don't expect everyone to be on the same page. Luckily, we all happen to be on the same page. So that is the stars aligning for us. That's it. So it's a good college to be in to do your residency in MD physiology.
Right, sir. Sir, also as a part of your residency, you are asked to conduct lectures for the undergraduate students. So, how is that experience for you?
Uh, you're not directly put into teaching undergraduate at a lecture level. They take you from first year. You give your briefings for your lab sessions. They give you the labs first, so that labs are the one thing that post MBBS person is most comfortable with the basic knowledge. So they start you off with there. Slowly, you've been given a small group discussions, then your tutorials. By the time you take your entire MBBS class, you get your practical briefing classes for your entire MBBS batch. You don't get a theory class because that depends from college to college and the curriculum to curriculum what they follow. Handling UG is quite tricky. Actually, when you have to teach MBBS students, the knowledge level should be at a level where you can answer any doubt that they're shooting. And every let us assume I am the PG and you are my student, your understanding of the subject is different rather than mine. So your understanding of the level at entry level physiology is just mitochondria is a powerhouse of the cell. Now we pick up from there and we push you into something deep. So your brain runs at a faster pace than me because you're more curious. With that curiosity comes more doubts. You need to be ready into handling that doubt as a resident. I feel teaching undergraduate students, you're not actually teaching them, you're teaching yourself and you're learning yourself. Also, it's a big responsibility. And the hard truth is, most of the students also, their, their knowledge level right now has changed. Yeah, understandings of the subject has changed. Things come more easily to them because of the accessibility of digital media to them. So let us assume taken a class today. The student has not understood. He is not going to come back to me with a doubt. He's going to go, he's going to open his YouTube, he's going to look into it, and he's going to get a in detail repeat review of the subject or the topic that they're there. This is a hard truth that is there. It is not demotivating someone or taking away something from someone. Students are actually learning more from YouTube and prep ladder and marrow videos than they're learning from the class. The only thing they're most interested in learning is the practical aspects of how to deal with, because those things are not taught on your digital platform. But I would not encourage students to go ahead and get prep ladder and marrow at a first year level, because they speak at a very high level. For you to understand that, your basic understanding should be better. So teaching is good, but their understanding has also evolved. So you also need to evolve in telling them what is right, what is not right, and how to guide them properly. All these things also need to be addressed. These are all not one-dimensional things; they are multi-dimensional aspect to most of the questions you ask. So understanding what the key aspect also, that depends from resident to resident in a college to college area. So there also experience might differs. So yes, it is enriching and good, but we need to understand the back end process and the front end process, both of them, to become a better, educator, in my opinion.
Right, sir. So, sir, I was going through your LinkedIn profile, and the very interesting thing I got to know about from your LinkedIn profile that you have done FIFA diploma in football medicine. So, sir, how was it? How do you come? Like, how did you got to know about this? How did you go about this course? And what do you think will be the good side of doing this diploma course?
Right. So this I didn't know by myself. This I got to know by attending conferences. I have attended a sports medicine conference. There I've met my few friends. I met people and they became my friends later on, who are doing their residency in sports medicine. So they've told me that there is a course like this which is free. They dwell more into exercise physiology. They dwell more into doping, which is a current topic. So I thought, okay, why not give it a try? I've done that. So there are lots of free courses that are available, and these are usually accredited and approved by a lot of governing bodies. So I went into it. Football is one of the sports that I play as well, and I want to pursue exercise medicine or exercise physiology, and one of the aspects is football as well. So I thought, why not go into that and see how long it will take. It will hardly take a month to finish it. You just have to go through all the lecture videos that I'm providing, write the exam, and if you're good with it, if the FIFA is good with it, they'll award a diploma then and there. So it's not something a big thing, big achievement that I've done. It's just a free course. I've just taken advantage of the fact that people know that there's something of this exists. I've taken knowledge from them and I've imparted into my understanding and my level.
Excellent. Sir, where can someone look for such similar courses?
Uh, Google. You have to go through Google left, right, and center, and you have to talk with people. There are courses which ICMR also offers for free. There's Swayam portal, which offers you biostatistics, exercise physiology courses. There are tons of medical courses that you pay 1,000, you write the exam. If you clear the exam, you get the certificate of that. So there are tons of free courses available everywhere. There's a medical devices courses that Swayam offers, which is a central government initiative. So these are all carry credit points. So these all get added to you, and you need to talk to people. That is something medical people lag. We usually behind getting patients rather than talking to other people and getting what they know. So talk to more people. That gives you an idea of what is happening for free. To be frank, in my opinion, there are at least 100 to 200 free courses that are available for any medico to get it done. On if you just have the patience to sit and search on Google with certification which is accepted with equal credit points. So these things have to be searched on Google, and you need to have the hustle culture in you.
Right. So the this can be done at the undergraduate level also, or just at the postgraduate level.
You have undergraduate courses as well. They have clear differentiation saying that this is an undergraduate level course, this is a postgraduate level course. So everything is clearly mentioned whenever you go through these courses. My best bet is Swayam. Swayam portal has offers wide variety of courses. Swayam portal, NPTEL portal. These offer wide variety of courses that you can get it done. You have modules to finish. Once you finish the module, select your exam city, then pay ₹1,000 fine for the exam, ₹1,000 fee for the exam. If you clear that exam, you're done. You have a certification course. But more than certification course, what I feel is the modules and the people that give you and impart the knowledge. I don't feel any books can give you that. That is where you need to be focusing your energy on. Nowadays, I don't believe certification courses matter in this world. Every Tom, Dick, and Harry has a different certification and they're able to crack anything. What separates you is the knowledge rather than the certificate, the knowledge. You need to gain that knowledge. Once you have that knowledge, you're untouchable.
Right, sir. Sir, what is next after your residency? What is next for Dr. Vivek, sir?
For me, that is a tricky question because as I've told you, I have enrolled my knowledge and enrolled my brain into figuring out what is to be done. I've still not come to terms as to I'm going to fixate only on one thing. So as of right now, I am taking every day as it is, enjoying my residency, learning new things, getting to know what are the more opportunities, more options that are available. As far as I know, I've only given you part of the knowledge that I have known. As I speak with you, I'm still communicating with other people into gaining their knowledge. So once I figure out and come to a place, you'll be the first person I'll tell.
Yes, thank you so much. So, sir, someone who is not inclined toward research, so do you think they should rule in or rule out physiology?
They can always rule in. Research is just part of the package. You can always do your get your teaching and get your fixed salary and you can lead your life. Research is not that big of a deal, for most of them. Even now, it's a hard cold fact. Nobody wants to speak about, but it's a fact. We India does not provide much of the basic research that is there. We only provide substantially minimal research. So research is not that big of a factor, but if it is there, yes, you will be in a very good position. But as far as I'm concerned, it should not be that of a big factor, into taking this branch.
All right. And do you think, sir, it is a skill that should be that like someone gets if he is not much inclined or he doesn't like over the time he might like once he get into the thing.
That is a skill that is an area that all medical students need to have. That is something medicine does not teach you. Our curriculum and course is designed in such a way that research happens once you reach your PG level. At a ground level of first year MBBS, second year MBBS, third year MBBS, not many colleges deal with research. It's only happening at the highest of high level institutes or a very good institutes with good funding. At regular medical colleges, that topic is not touched upon. So medical students should be exposed to that research level. Now the curriculum incorporates basic level research, but still we are still far off from the research kind of research that can be done because we have the population, we have the student pool. The only thing that drags us back is research is expensive. You can do a basic research also, but the impact of that, how much would it be, also differs. So a high-end level research at a genetic level or an epigenetic level requires a lot of cash inflow. For that, you require funding. Funding takes up a lot of your energy. Then you're not a researcher, you're a manager. So you need to handle multiple things. And yes, if given funding, I believe the private players, the private companies that are there, the software companies, MNC companies, or the pharma companies, they should also collaborate with medical colleges to, in getting the basic research done. Because what is it happening is a person is doing a research which is just for academic purposes. It is not to the market. Once you do to the market research, you have something that the consumer requires. Once you're creating a market for that, then more research happens. So I definitely believe everyone should be inclined to market level research, into understanding research fundamentals, into understanding data analytics, into understanding statistics. All this should become part of more part of your medical career. It is our community medicine is a big aspect in this. But at an MBBS level, we only deal about the community medicine level aspect. Once you come into the residency level, all these things, your brain opens up. But you need to tell the student about all this so they have an informed consent view about what residency program you need to pick up. So yes, I believe research should be made mandatory for everyone. It's not like individual person can't do a research. Tag along 5, 10 people, collaborate and do. India can has the potential to become a global hub for medical research. It's just that there are factors which I cannot personally talk in this podcast because it is going to ruffle a lot of feathers. So keeping that away, yes, research should be made mandatory and for everyone in medicine. Once you do research, your brain opens up to a lot of things. If that happens, sky is the limit for a medical graduate.
Yes, sir. So, sir, according to you, who shouldn't opt for MD physiology?
Everyone can opt for MD physiology. I'm not going to deny anyone. Everyone can opt for MD physiology. See,
Perfect.
the thing is, I'm not going to discourage anyone from taking anything, and I'm not going to say that if you're an MBBS graduate, you have the competency level to pick up MD physiology. So you're always welcome. I'm not going to say no to anyone.
Perfect, sir. That was the best answer to this question. So, sir, someone who is joining, let's say, who is about to join their residency in MD physiology. So, what is the advice you want to give to them?
Keep your brain open to doing multiple tasks. Don't just fixate on one point saying that it's a preclinical branch. I'm going to come here, do the basic work that is required. I'm going to finish it off and go back. Have that knack and have that energy and zeal to do something out of the box. You might not be the person who is doing things out of the box, but have that courage to step out of the comfort zone. Once you do that, you will have an ocean full of opportunities for you to deal with, and then you will be able to guide your juniors in a better way to pick up something that they can excel in. Also, we require more MD physio people to do MD physiology. Until you have a market of 100, 200 people who want to do clinical physiology, there is a market that needs to be created. That is when you're going to create a market, and that is when you're going to create an opportunity for people to actually sit and think that yes, clinical physiology is a branch, and hospitals, corporate hospitals, will accept for that. So you need more people to come in. Everyone should opt for it. Everyone should pick it up, and everyone should have that like-mindedness and openness to try something new. That is what I believe.
Yes. Just to summarize, can we say that someone who is joining MD physiology should be a true Medhustler?
Exactly.
Yes, sir. So, sir, I think like I have seen that there are not much medicos who are active on LinkedIn. So, can you tell our audience those medicos who are not on LinkedIn, what are they missing out?
LinkedIn is a good platform which offers you good socializing feature with everyone, almost everyone. It's like Instagram, but it's absolutely free to connect with, and you can have a conversation, a business conversation, or educational conversation. you can pick up some things. Nowadays, what I'm seeing is, yes, what you have told is partly correct. Nowadays, the newer generation medicos are opening their LinkedIn profiles at a first year level, even though they might not have much content to put it on there, they're active on that. But that level is very, very niche. That level is very little because these people have access to iPhones, and these people have access to Instagram accounts that they deal in a different level. And also their parents also deal with LinkedIn. They see that and they pick it up. I prefer every medico opens up a LinkedIn account, a professional channel on YouTube or on Instagram, anywhere. They need to know how to socialize because socializing skills are not taught to us. That is one aspect which we lag on. And once you socialize, you get to know other person's perspective. There you listen. In class, you're zoned out. But when you're actually talking to someone whom you want to talk to, there you actually listen. And the impact that will create on someone is humongous. It might be a good experience, it might be a bad experience, depending on whom you're talking to and what is the situation there. But LinkedIn, as far as I know, opens a lot of doors. It has personally to me, so I can suggest that yes, LinkedIn should be made mandatory, not at a policy level, but yes, you should be open to open use it. And other socializing platforms as well. People should be active on everything so that they get to know what is happening in the other part of the world. You can't sit and study like a duck in a pond. You need to know what is happening, what cutting edge research is happening. LinkedIn offers you all those insights. So you need to be able to take the maximum advantage of that.
Yes, sir, definitely. So, sir, I think that's all about covering MD physiology, its career aspects, and everything regarding the MD physiology and the overall this branch has to offer. So, sir, thank you so much for tuning in. To all the viewers, I would like to tell them like watch this episode till the end so you can get holistic view about MD physiology and the career prospect related to it. So, sir, you had a very immense journey. You have very immense knowledge that you have given to our audience, and I think this will create a complete guide for them, those who are thinking or those who are no thinking to opt for MD physiology. Now they have a more clear picture after this, after listening this podcast. So, thank you so much for joining in, sir. Do you have any final words to conclude?
I am just less than 1% of the knowledge that I have given you. There are people, better than me who can give you better answers as well. I'm just part of this. So I've only given you opinions from what I know. So as far as I know, I've given you the perfect things that I know. And there are other people also that you should get into contact with. Once you get into contact with them, it will become more engaging for the students as well. So down the line, maybe you can do that as well, and give the help that the students require.
Yes, sir, definitely. Thank you so much for tuning in, sir.